Yeah. Good evening or good afternoon, everybody. ನನ್ನ ಹೆಸರು ಡಾಕ್ಟರ್ ವಿನೋದ್ ಬಾಬು ವೀರಪಲ್ಲಿ ಅಂತ. I am a consultant at Dr. Mohan's Diabetology Center in Indranagar in Bangalore. So, for today's discussion, we are going to talk about mainly pre-diabetes, what it is, how you can identify it, what can you do to prevent it from going to diabetes, whether it is reversible or not, what are the conditions or clauses associated with that reversibleness is the main topic today. I know many of you are curious about this pre-diabetes status. You might have got your annual checks, and during that you would have seen that HbA1c is going up. So you're naturally concerned, and you might have found this link somewhere, and thought that this guy can talk some sense about it. That's what we're going to do, and we are going to discuss in English. Any of you, if you have any questions, please put it in the comment section. And at the end of this talk, we will answer those many comments to the best of our ability. Even if it is so silly, don't worry. No question is too silly in diabetes. We educate our patients. We get surprises in our clinic sometimes, even after seeing so many patients for so many years. We still would be surprised. Somebody would be very introvert and they feel like, this is too silly question to ask. They don't ask those questions, and then, they end up suffering a complication from it. Rather than that, you please put up your question and I will try to answer those questions to the best of my ability. So, without much ado, what is pre-diabetes? That is the first question. Okay, it is the beginning stage of diabetes. So, diabetes, why it occurs, we need to understand this. When we are learning these parts of the body in the school, we know eyes, ears, mouth, the heart, kidney, liver, all these locations. But none of us get told that where the pancreas is, because you don't see that very clearly in the body. It is obscured. There is an organ behind the stomach, where this is where the stomach lives, and behind the stomach and before your spine, the pancreas is a leaf-like organ which is continuously producing insulin in all the animals. The purpose of this hormone called as insulin is to keep your glucose levels under normal range. So what happens, why some of the people develop diabetes or pre-diabetes once they become older is, just like the way our height, our skin color and height is determined by our genes, or means our parents and grandparents, this diabetes, the size of the pancreas, how much capacity it has, how much extra reserve it has to produce more, insulin, all these factors are determined by our genes. So this is a predominantly genetic disease. So lifestyles, whether they will change or not, yes, definitely lifestyles will affect, but the weightage, is more for genetics rather than the lifestyle. Lifestyle means what we live and exercise, what we do. That is what we call it as lifestyle factors. So whenever we eat food, means rice, wheat, ragi, vegetables. Some of these foods contain more carbohydrates, like rice, wheat, and ragi. All three contains more carbohydrates. Less carbohydrate foods like oats, millets, and other foods, other staple foods, and almost negligible carbohydrate foods like vegetables, dals, dairy fruits, and non-veg, zero sugar. So all these foods, which don't contain carbohydrates. So when you eat these foods, when the digestion happens in your intestine, these hormones will stimulate this insulin production. Once the glucose enters into the blood, when carbohydrates get digested, glucose is released. That is the fuel for the all the cells in the body. So when this glucose gets released and enters into the blood, pancreas sees that and releases more insulin. When your sugars are rising, insulin levels also rise, and thereby keeps the glucose levels under normal control in a normal person with normally functioning pancreas. This mechanism is impaired initially. It doesn't happen in a day or two. It slowly, normal person, okay, it is functioning well. After certain years, it develops some weakness. Just like our vehicles, cars doesn't, of course, there are problems where car suddenly stops, but slowly our tires start wearing out, and later one day a puncture happens. Similarly, pancreas ability to produce insulin starts, some starting problems will come. And if you check in such people, you see the after food sugar. If they eat a carbohydrate rich food which contains more of rice, wheat, or ragi, or ice creams, or chocolates, or any sugary foods, Then the after-food sugar shoots up first. That is what is impaired what we call IGT, impaired glucose tolerance, IGT. And in some people, if you randomly check the fasting sugar elevates. So this is a whole bunch of starting conditions, pre-diabetic conditions, what we call impaired fasting glucose as well as impaired glucose tolerance. When you challenge the body with more glucose, then only you will see the abnormality. So this is the starting stage of diabetes. Or in simple way, if you do a test called as HbA1c, which gives the average of your last 3 months sugars, then you will see this is abnormal. Normal value is below 5.8. Somebody gets 5.8 to 6.4. We call it as pre-diabetes. Means they're moving closer towards, their sugars are slightly increasing and moving towards the level where we call it as diabetes. So in such people, it is invariably followed by diabetes. With aging itself, pancreas will lose the ability to produce insulin year on year and then later converts to diabetes. So this is the natural progression. A normal person, puts on weight, becomes pre-diabetic, then after a few years converts to diabetes, and diabetes requiring medication, maximum medication also not controlling, then you need to add insulin from outside because problem is insulin production in type 2 diabetes. So you need to add insulin from outside, then yes, the person would have managed these complications of diabetes for a longer number of time and then live more number of years. So similar, see, why we should control these sugars, why we should keep it in the normal range. Imagine you have plants at home and you try to, you're watering them and they grow very well. Start doing, putting some salt in the water, increase the salt content and then start, pouring that water to the plants, and the plants will die slowly. So that is what happens in diabetes as well. When your blood, which goes all over the body, contains more glucose, it kind of acts like a slow poison to all the cells in the body, starting from eyes to foot. So one by one, depending upon the degree of the sugars and the duration of exposure of organs to such sugars and your inherent ability, some people develop kidney disease faster, some people develop kidney disease, eye disease faster, and most people heart disease again is the weakest organ in our body. Even though it is the strongest or muscular organ, it is the weakest point in our design. So all these organs start getting affected because of long-term uncontrolled sugars. You don't get to see this in a day or two. There are other complications when your sugars go very high and immunity comes down. It puts you at risk of dangerous infections or acid levels start. But when your sugars are uncontrolled for a long time, it causes a slow and sustained damage to all the organs. And it becomes at least, sometime it needs around 10 to 15 years in order to see those changes. That's why we tell all our patients to screen yearly one time for their eyes, heart, kidney, and feet. These are the organs which gets affected in diabetes more commonly and leads to certain conditions like loss of vision, heart attacks or strokes, or kidney failure requiring dialysis, foot ulcers requiring operations or removal of the feet, and non-healing wounds. These are the common complications that a diabetes person goes through if diabetes is not well maintained. If you manage it well from the beginning, managing it well means, of course, the first step for any diabetes or even pre-diabetes is addressing the lifestyle changes. If you are somebody who is not exercising, you definitely need to exercise. That will inculcate the habit of discipline, and it will reduce the need for many medicines, even for pre-diabetes or diabetes or uncontrolled diabetes. It doesn't matter who you are. Half an hour of activity per day will go a long way in reducing the number of pills that you need to take. And the lifestyle change, mainly the dietary changes, what we call medical nutritional therapy. What kind of a therapy we give? Mainly, we advise the patients to reduce the carbohydrates. Indians are very fond of eating carbohydrates. When you go to US or UK, you don't see people eating this much of carbohydrates. We love our idli, dosa, vada, pongal, sambar, everything contains laden with the carbohydrates. What is this carbohydrate? Mainly rice, wheat, and ragi constitute 60 to 70% of our diet. So that is the reason, why Indians tend to be more obese, and India has the highest number of diabetics next only to China today. And very shortly, in the next, 1 or 2 decades, India is expected to even overcome China in terms of the number of patients with diabetes and truly become the diabetes capital of the world. And not just that, in India, Indian genes, even if you have diabetes, the obesity is common. The overall affecting on the heart, means the mortality rate or number of people who die with heart disease is the highest in the world. Even, China has more number of diabetics. Still, not many people die. Indian genes makes us more vulnerable. We need to be educated. What is this pre-diabetes from the early stage itself? In school itself, it should be taught. Here is your pancreas. This is the one which causes diabetes. What is pre-diabetes, and what you need to do with respect to healthy eating. All these things needs to be taught from schools. And unfortunately, when I did my schooling in remote place in Andhra Pradesh, at that time I was not taught about this. We were only reading questions and exams for the essay writing and all were there, but we were just memorizing that and replicating that in the exams to get more marks. So truly understanding these things and relating to the real health problems that we have, that one, then only it will translate to benefits for our country as a whole. So this diabetes, as you know, is a genetically predominant disease, predominantly genetic disease. That is type 2 diabetes. There are several types of diabetes. Again, that is beyond scope for today's discussion. Let's limit to only type 2 diabetes, which you see commonly people taking pills for this, right? So that is the type 2 diabetes, and some of them require insulin later. So that is the type 2 diabetes. And it is preceded always, at least 3 to 4 years by certain abnormalities in the blood tests that you can do and identify. If you are 30 plus and has a family history of diabetes, or you have risk factors like obesity, you should undergo diabetes screening yearly once, because pre-diabetes or majority cases of the diabetes do not cause any symptoms like fever, cough, runny nose, or weakness, or increased urination. Only if the sugars go very high means alarming amount of damage is happening to your organs, then you will cause frequent urination or repeated urinary infections. You should not wait till that time, and start screening. Simple fasting glucose check. Borrow from a neighbor. You must have seen a glucometer. Some people would be checking that. Ask them. Or free health camps are happening everywhere. At maybe even Dr. Mohan's organization does a lot of camps. So in and around my branch, we go to the eateries in the morning. My staff would be checking free of cost to people to see who among them are actually diabetic and not aware. So you'd be surprised. Majority of our patients are not aware about this. So an average person who is busy with his life-to-life workstyle and worried about how to navigate in this maze of traffic in Bangalore, they get lost. They don't get educated, through any means by this. So important, utilize those ways to see whether you're a diabetic or not, where you stand in this, whether you're a normal person or a pre-diabetic person or already a diabetes person. So if you know this, and you will be subconsciously, trying to control, slow down this pace. So invariably, pre-diabetes leads to diabetes with age itself. Whether the person gains weight, it happens faster. If the person, doesn't do exercise, it progresses faster. So mainly, if you are a pre-diabetic and are thinking how I can, stop going to a diabetologist like me, is that mainly you need to do two things. One is controlling your diet and doing regular exercise, controlling your carbs in the diet, and checking your HbA1c 6 months, because HbA1c starts changing, right? With age, it will increase. So next time, if your HbA1c starts coming below 6, pat on yourself and say that you've done a good job, and you have not come to the level where we call it as diabetes 6.5. And there is even another school of thought, world over, people are realizing the harmful benefits that diabetes as a whole is possessing to their populations, and has advocated metformin to be given in pre-diabetic stage. One of the oldest, safest medicines, even pregnant ladies can take it. One of the only drugs on the planet which can, increase the life overall. They're given this metformin to half of the rats and half they didn't give, and they have seen that the rats have actually lived longer. That is true in humans as well. So several confounding factors may be there, but metformin till date, we don't know how it works truly. Exactly where it works, we do not know, but we know it is safe. It is the oldest diabetes drug we have, and it is the safest drug as well. And yes, side effects will be there for every medicine. Any water you take more, or any homemade food you take more, there will be a side effect. Body can't tolerate more. Similarly, any drugs, whether it's homeopathy, allopathy, ayurveda, they have adverse events. No matter whether the person who is prescribing that to you is communicating that to you is not, that's different. But every medicine has side effects. So similarly, our medication metformin also has some side effects. But with that said, we know exactly what percentage of the people have developed these, and then we suggest remedies to that. So Some of them develop stomach upset. Some, yesterday one patient came, gave the history that, HbA1c is very high. When I was inquiring, doctor, one tablet start ಮಾಡಿದ್ರೆ ಮುಂಚೆ ನಮಗೆ ಆ ಟ್ಯಾಬ್ಲೆಟ್ ತಗೊಳ್ಳೋದ ನಂತರ ಲೂಸ್ ಮೋಷನ್ ಆಗಿದೆ. Then we know, oh, probably this was metformin. We can try other drugs. We have 5 to 6 different classes of medicines which can help control the diabetes. So depends on the patient. Patient overweight idaga, we have certain medicines to make the person lose weight as well as a side effect. That's a beneficial effect, I would say. So 2 to 3 kgs loss agidare, then it will help with the patients live longer. So we need to tailor make those decisions as to which medicine to be used in specific patient, depending upon the person, depending upon their HbA1c, depending upon the weight and the lifestyle. All these factors we need to take into account while prescribing which medicine to be used. So pre-diabetes as such, in some countries they use metformin as a drug, but I usually don't. I recommend my patients to resort to a healthy lifestyle and monitor the HbA1c. If HbA1c is coming closer to 6.5, then it becomes imperative that the patient takes the metformin to benefit from it. So that is one thing. And if you become 6.5 to 7, yes, you are a diabetic, and still below 7 is considered bit under control diabetes. So metformin role is up to then only. If your HbA1c is crossing 7, you need to use the other powerful class of medicines. We have this DPP4 inhibitors ending with gliptins, which do not have any adverse events that we know of. It's comparable to a placebo. Means, if you give some other pill and then this pill to 1 lakh patients, almost the side effect profile will in both groups will be the same. That is what we call it as placebo, comparable to a placebo. So you can use these medicines as first line, or even we have the SGLT2 inhibitors and names ending with glifosins, which cause weight loss, protects your heart and kidney, and controls your sugars. These additional advantages, what we call pleomorphic benefits, are available with newer class of drugs. And again, older class drugs, glimepiride, glibenclamide, gliclazide, all these older class of drugs are very powerful, very effective at controlling sugars, but again, low sugar risk is there with that. So depending upon the patient, we choose these medicines. And it's important that you need to have a long-term plan, because this diabetes is not going to go away anytime. Mainly their marketing buzz today is when you look for diabetes, reversal. So we'll talk about that as well. Now that we have completed, what is pre-diabetes, and what can you do to prevent it to convert to diabetes, and why is it important to control diabetes. So some is a big problem. Imagine you have a major financial problem. Okay, so you're going through means like you're cutting down your savings, and you're having sleepless nights. You're wondering how to get out of that mess. Somebody comes and tells you quickly, you go and approach your friend, he will give you 1 crore. Will you believe it or not? Similarly, diabetes is a major problem. It is a chronic disease. Chronic disease means it runs throughout the life. It's very unlikely that it will go into a reversal state, or completely go away from your life. It's not like our fever, cough, or so important to distinguish acute infections like fevers or COVID or influenza from this chronic diseases like diabetes, hypertension, thyroid, or even cholesterol. All these are lifestyle diseases which are majorly affected in virtue of your genetic makeup. You contract these as a gift from your parents or grandparents. So we can't really do much about that part. Yes, definitely there is some impact which you can create by adopting healthy lifestyle changes, but will that be enough is the question. So diabetes left alone leads to organ damage. You may all have seen, eye problems, heart problems, kidney problems, and foot problems, even stomach nerves problems, erectile dysfunction. These are all the complications, repeated skin infections, lowering your immunity overall, and improving and increase, making you vulnerable for life-threatening infections. You remember when COVID made landfall in India, you have seen, government was initially advising admission people with comorbidities. What are those comorbidities? These chronic diseases, diabetes, hypertension, heart disease, kidney disease. So these people have lower immunity than children or normal adults, and they are more likely to get hospitalized any infection comes, not just COVID-19. We have seen that happen when COVID vaccine came also. That is the only thing, which was making the change in the management of the pandemic. When second wave came, people were not taking the vaccine. Vaccine was ready. Government was giving it to everybody in March 2021 itself. But, April and May, they waited thinking that nobody else is taking, why I should take. By the time all our healthcare workers have taken the vaccine. So, mortality rate is negligible in healthcare workers, but in people who didn't take the vaccine, we have seen, so we lost some of our close friends, relatives as well, in our own families to that wave. But when 2022 January came, Omicron, which is even more infectious, that affects more people, virtually impossible to stay unaffected from that when you're in a country like India where there is overcrowding. So in such wave also, when everybody took the vaccine out of fear, it worked. Mortality rate, hospitals didn't get filled up. We were very happy about it. So this is the kind of impact a single vaccine can make towards a disease. Similarly, diabetes patients are vulnerable to any infection. Their immune system is weak because WBC is staying in the same blood where this glucose is present. And if it is present in large quantity for a large amount of time, WBC leads to reduced immune response and gets confused and attacks your organs. That's how COVID caused the lung disease. Similarly, influenza, right now H3N2 influenza is doing waves all over the world. We are going through the pandemic, only we don't know it because there is no testing in India. We have testing, but we limit it to only serious patients, and it is expensive. That's why we don't routinely recommend to somebody who has runny nose or fever. But COVID was different. We didn't have natural immunity. Now that we have immunity, we don't test for it. So similarly, COVID influenza also, we don't test for it unless the patient is having severe symptoms or at increased risk. So here, influenza also, there is a vaccine which you can take yearly once. How many of you have taken it? In Western countries, NHS, or you look at US or Canada, or even smaller countries towards the east, Hong Kong, Vietnam, they are vaccinating all their population, starting from children to adults, whether they have diabetes or not, with influenza every year. That's why we get to see less mortality there. Life expectancy has improved. It's important. If you're a diabetic, please remember to take this influenza vaccine at least yearly once, preferably in the month of August, September. Why? Because every year new strains will come in influenza and new vaccines will come to India in August, September, a little later than Western countries, as we have seen with COVID vaccine. Similarly, if you are not taken ever, don't neglect it. Still, we have so many cases right now in March itself in Bangalore and the rest of the country. Please take your vaccine and wear your mask and follow the COVID appropriate behavior. That's hand sanitation. It works well for influenza also. It's also virus. So please stay indoors for 2 weeks at least, because it takes time for the vaccine to start protecting you. 2 weeks is the time, anticipated or estimated time. Nobody knows for sure. So taking this, and also one more vaccine, pneumococcal vaccine, one time in life. All the children who are born in the last 10 years are recommended this vaccine now, are getting it at the time of my birth itself. Each child, my daughter, 1-year-old daughter, got it 3 times already. She will get the 4th one at 1.5 years of age. So important, for diabetes patients to take this once in their life at least. Why? Because this was not provided at that time. When you were born, this vaccine was not there. Awareness was not there. So it's your job to be aware about this, learn from your healthcare provider, and then take this vaccine. This bacteria, you cannot prevent it. Majority of the ICU admissions are actually, if you look at 10 years back, admissions were from bacterial pneumonia. So that still constitutes a large chunk of our patients. Many people die and go on to ventilators because of these infections. So by simply taking one extra vaccine, if you develop diabetes, you are reducing the risk of dying from those. So yeah, enough about infections. Now we'll talk about the main, diabetes control. Yes, we have medicines. We need to use those medicines lifelong, most likely. But there is a marketing word these days, yes, taking medicines lifelong, checking your HbA1c every 3 months, and if it is more than 7, changing them, adding some more medicines of insulin. This is the really hard and challenging process. Anybody who listens about it will get bored. But this is the time-tested way and proven way, only proven way to increase the longevity. That's how the Western worlds have increased the life expectancy. India is on the right track, but it's very slow, I would say. Awareness is still very less about diabetes and the need to take medicines. And once in a while, somebody will come and say that I will cure your HIV, like that. They'll say that I'll cure your HIV, diabetes also by taking to some magic. I mean, people tend to believe it because their understanding is less. So there is this talk about reversal. It gives the idea that you're permanently being cured about diabetes. That is the impression a patient gets when you go into such centers. See, there is no true reversal of diabetes. So when you gain weight, diabetes comes faster. When you lose weight, diabetes will be under control. Your sugars will be under control only for some time, some years. The means through which you are achieving that weight loss needs to be sustained. in order to get that benefit. Meaning, if you're following one calorie restricted diet, where you'll put on only 1 or 2 meals a day with less glucose, yes, you will be sacrificing your happiness. You are motivated initially, you will follow that. Your sugars respond. The moment you switch to your old diet, your sugars will shoot up. That should not happen. So the benefits that you get, definitely if you restrict the carbohydrates in type 2 diabetes, you will see some benefit. This response to carbohydrate restriction, because it's a lifestyle change you're making, but that does not change your genetics. It's like, you're doing something and your height will change. It will not change. So similarly, this one, generally, if you say you're restricting your carbohydrates and your body fat lose, and the insulin which is produced naturally from your pancreas works better, and your HbA1c starts coming down. This is seen even during pregnancy also. Imagine a pregnancy woman, a woman who is pregnant, and during pregnancy her sugars were found to be high, and insulin is the safest medicine during pregnancy, so apart from metformin. So we use that to control, to reduce the risk for the baby, because we can't make a pregnant woman lose weight, because nourishment is required for the baby. So we keep a very tight control on her sugars and deliver the baby. Once the weight loss occurs, diabetes will go away. Should we call it as a reversal? No. When a person loses weight, another 3 or 4 years, they do not need any medication. And slowly, the pregnant woman, even if she stays fit and maintains the same weight, 4 or 5 years down the lane, they will get diabetes. Her sugars again shoot up. Similarly, these weight loss programs, what they are, glorified weight loss programs or glorified dietitian-based programs, they put you on calorie restricted diet, very low calorie diet, where you'll have to tolerate that hunger, and then of course with that your sugars will respond. As long as your sugars are under control, medicines will come down. Even in my patients, when you see HbA1c coming below 7, below 6, I will start reducing my own medication. There is no need. The skill is to identify the minimum amount of medicine that a patient needs to keep the HbA1c below 7 or 7.5, as your case may be. So that is the logic behind treating the diabetes. And with the time, diabetes progresses. Remember that, just with time, you have become a pre-diabetic. After a few years, you'll become diabetic, and then, uncontrolled diabetes requiring medication. Then, ultimately, you'll require insulin as well. Some of them, not everybody. Some of them who's using maximum number of pills and still HbA1c is not below 7, you suggest insulin in such patients, because lifestyle changes take time. Even if there are patients who are obese and still sugars are not controlled, and we can't count on the lifestyle changes to bring those sugars, because every moment counts. Every HbA1c is giving the value for the last 3 months. That means we can't do anything about those 3 months. The damage is done already. So we have to look at that number and change the current value. That's why we tell the patients to monitor at home to see how is today's result. If the today's result is good, yes, and you keep maintaining like that, yes, HbA1c comes down. That's the best way actually. And we even adopt these sensors in our center. No need to prick. You just attach one sticker kind of a device, rupee coin size of a device to your arm. It will check your sugars 24 hours, every 5 minutes. And it will give you a beautiful graph to see, how your medicines are working. Of course, it costs money, but again, there is no need for type 1 diabetics or uncontrolled diabetes patients to prick as they used to do before. You can put the sensor and get to know which medicines are working to which level. You can determine at what time actually the patient sugars are high, so that you can intervene there by giving a little bit more insulin or more medication, target that area with more medication, and then control the sugars and, getting the sugars into the normal range. So these are all the, ways which we use in Mohans, which is practiced all over the world actually. So, I really call upon, my viewers to please learn these things and spread that message to your nearby parents or elders who may not be aware about these diabetes, why it occurs, whether it is something which I can get rid of. And then, as a country, we will, reap the benefits of such education. So I think, I have spoken about the weight loss and reversal and pre-diabetes so far, why we need to control. Let's take some questions, and then, we'll move on to any other interesting topic that you may have. We'll discuss that. So what is the best diet plan for pre-diabetes, Mr. Malti Ravindran? See, there is nothing like a one size suits all diet for everybody. So South Indians prefer rice, North Indians prefer chapatis. If you go to Scandinavian countries, they eat more of vegetables. If you go to Western countries, they eat more of less fiber diet and those such. So there is nothing like that. We need to take into account what is the proportion of major food groups needs to be balanced. A balanced diet is the best diet. There is no quick keto diet or intermittent fasting. All those things are, yo-yo, or what we call fad diets. There is no evidence to say that intermittent fasting alone will help. Mainly reducing the calorie deficit. If you achieve the calorie deficit, people will lose weight. That's simple, as simple as that. Follows the law of conservation of energy as per physics. And there is no way we can cheat physics or chemistry. They are exact sciences. So it holds good on Earth. It holds good everywhere else in the universe. So similarly, when you come to diet, make sure that there is 25% of your diet should come from proteins. Dairy products, which for a vegetarian is a good source of protein. Dals are really good. If you're a non-vegetarian, you can take eggs, fish, chicken, skinless chicken, and rarely mutton, in that order. So these are the good sources of protein. 25% of your plate, every meal of the day should come from that protein source. And, 50% of your diet should come from vegetables. The more colored they are, the better. Like your, all the vegetables, tomatoes, except potato or tapioca or starchy vegetables like tapioca, colocasia. You can have all the vegetables, all green leafy vegetables. They don't contain much of calories, very, very less calories. Carrot, beetroot to some extent. Yes, all this can be taken. 50% of your every meal should come from these salads, cucumber, carrot, onions, everything. You can add all these vegetables. India is a predominantly vegetarian country, so we should eat more of vegetables. It makes more sense to us, to follow that route. And only 25% should come from our carbohydrates. Or if you want to lose weight, you need to restrict that even lower. Right now, we are eating 60% of carbohydrates, so that is the main difference. There is a lot of amount, work needs to be done. And definitely, you don't need 3 meals a day if you're looking to lose weight. And that is, if you're not on any medication, definitely you need to, eat your meals on time when you're a diabetic who is on medication, because your risk of low sugars will be more. Medicines can cause low sugars if you don't eat. So with that, if you're trying to lose weight, you don't need 3 meals a day, 2 meals, or 2 meals a day enough. Then it's an easier way to restrict your calories. It's easy to lose weight by restriction of your diet rather than exercise. More exercise will not necessarily lead to more weight loss. So that is very important to understand these concepts. And yeah, when best diet plan, 25% carbohydrates, 25%. Even in the carbohydrates, prefer millets, because they contain less carbohydrate percentage than rice, wheat, or ragi, which contains 75%. Millets contain only 50 to 55%. But still, you should not overeat millets as well. So 25% carbohydrates, 25% protein, 50% vegetables is the plate concept, what we call. If you divide a plate into these respective precautions, you can just Google it. You can get to know those, what are the foods and not. That is the best diet. Instead of going through our dietitian's given plan, which is very difficult to follow. You can't keep that chart in your kitchen and make the food every day. Having broader understanding about these food groups and what percentage of these foods needs to go into your meal will help you make those diet plans. And even, one thing interesting I would like to share here: when you use customized, continuous glucose monitor, CGM sensors, you can customize your own diet. Let's say every person's glucose curves are different. Everybody will have a different, just like our fingerprints or signature. Everybody's glucose curve is different. You can see which meals actually leads up to high sugars. Suppose you take high carb diet in the morning, that I'm shooting up. But afternoon, if you take the same tiffin or item, it won't shoot up, because your pancreas is producing more insulin at that time. It didn't shoot up, so you don't have to restrict if you don't have issues with your weight. So these are the kind of customized diet changes you can make in your own menu of food items using the CGMs. Yeah. Let's move to the next question from Ms. Nikita Sharma. Doctor, could you please give summer tips? What kind of foods and juices we can take, and how many liters of water we should take? Water needs of the body is regulated by the body itself. How much water you need. When your water contents become less, body stimulates the thirst, and your water content is more, your thirst will come down. That is a natural mechanism which is present in everybody. And with that said, when the environment around us changes, not everybody listens to their body. Even if they're feeling thirsty, they go on with their work. That's where these problems come. And there are certain medical conditions and medications. When you are taking them, or when you have these diseases, you need to drink more water. Diabetes as a general doesn't demand any excessive water intake, but since you are taking some pills to control, most of the patients take pills to control these diabetes sugar levels, it's advisable. These medications get entered our system, they do their job, and get excreted through urine only. Majority of these drugs get excreted through kidney. So you need to stay well hydrated. Well hydrated means adequate amount of water to pass clear urine. So urine should not be very dark colored. Clear urine at least 5 to 6 times a day. So that is the definition of adequate hydration. In summer, the body needs, because your sweating will increase, and your overall metabolism will increase in summer. So you need to take more water during summers. That would roughly be 3 to 4 liters for majority of the patients, except those patients who are having kidney or heart or liver disease. They need to follow the 1.5 liter or 1 liter restriction that their doctor suggests. So everybody's hydration needs is different. You need to listen to your body and then adjust the amount of water according to the urination that you are going. Yeah. And some of our diabetes medicine, we advise to take more water, especially the newer class of diabetes drugs, what we call SGLT2 inhibitors, which I told you earlier, which will protect your heart and kidney and control your sugars, both, all 3 points, and cause some weight loss. You need to drink more water, because the way these medicine works is, it acts on the kidney to produce more urination or glucose. Glucose will be thrown away in the urine. With that, slight more urination will be there. So to compensate for that, you need to drink more water. If you don't drink enough water, this glucose will stay in the urinary tract for longer time, and urine bacteria is there, and it grows faster in the presence of glucose, and thereby putting you at increased risk. If I start it on 1,000 patients, 10 to 20 patients will develop urinary tract infections. So that a treating doctor should be aware and know how to treat it, and educate the patients to drink a little bit more water, like 2 glasses of water when you're taking this glyphosate, dapagliflozin or empagliflozin or canagliflozin. So I hope that answered your question. What kind of fruits and juices? Juices are not good. Rather than that, eat whole fruits. All diabetics can have fruits. Only when your sugars are very, very high, you need to adjust your medicine. Till that time, you need to restrict the fruits intake. Fruits also contain sugar, fructose, and as well as glucose. Very high sweet fruits, especially mango this season, and banana, whether it's robusta or elaki, contains more carbohydrates. So avoid those two fruits if you have trouble controlling your sugars. So number one, banana, mango, jackfruit, sapota, sitafal, grapes. These are the category of fruits you should avoid. If you're really fond of them, nothing like you should not take them forever. If somebody is coming, if really fond of mangoes, you can have them, but don't again eat a large meal followed by that. So you need to control the carbohydrate content and take it along with vegetables or protein rich food. That will not reach to your shoot up of your sugars. Should not do that every day also. So these are the fruits, and everybody can take, and some fruits very high carbs. And when general rule of thumb, if it's very sweet, even in apple we have Simla apple, local apple, Kashmir apple, we have several different, Washington apple. The one which is very sweet is expected to have high sugars. Nobody can do a study about it. Especially, National Institute of Nutrition, Hyderabad, has done several studies about the common foods. But again, every day new type of hybrids will come. It's impossible to have it. So rule of thumb is to restrict the amount of food which tastes very sweet. So mainly, many people think that jaggery and honey are good for health. They are very, very high sugar foods. So you need to avoid those if you are diabetic. They are purified sugar. So that raises your sugars, very, very high. So you need to avoid those. Don't think that they're good. Yeah. And yeah, that answers your question, I think, Ms. Netika Sharma. Mr. Shankar Babu, symptoms for pre-diabetes. There are no symptoms. That is the problem. So when a symptom comes, you will be aware about it, and then you seek treatment. Pre-diabetes, or even 95% of type 2 diabetes, don't get any symptoms. When they go for general checkup, or then they'll come to know. If sugars become very high for a long time, it progresses to next, 2-3 years, you have diabetes, then only you'll get to know symptoms. The damage would have started already to your organs. So your organs means heart, kidney, everybody would have started taking damage from those high sugars even before you know that you're a diabetic. That's the reason you need to screen, check for HbA1c. If you don't have a history of diabetes, you're lean, that's fine, unlikely. But you're having a sedentary lifestyle, majority of the people have. Yes, that's a risk factor for diabetes. If you're overweight, anything BMI more than 25, you would be surprised to know that majority of us are actually overweight, including myself. So it's genetic. Obesity is genetic, and some people will have a greater degree of obesity, some people will have lesser degree of obesity, but majority of us will perceive more weight as normal. That is because a few decades earlier, India used to have malnutrition. So people used to be underweight and used to overfeed. Mothers and grandmothers used to overfeed the children, and they become overweight, and they think that that's a sign of good health, because that time famines were very common. 1950s itself we had these famines. So People used to die due to lack of food. So now we have abundance of food, and the problem is the other way around. Overnutrition is the problem these days, and because of that, diabetes has become more common. Any weight gain leads to preponement of pre-diabetes and diabetes by few years. So that's why we are seeing more diabetes as well. So symptoms of pre-diabetes, in one word, there are no symptoms. Most of the patients, none of the patients have seen so far. Pre-diabetes don't cause any symptoms. Diabetes, yes, uncontrolled diabetes can cause symptoms, but you should not wait. You should catch it in the pre-diabetes stage, make the lifestyle changes that time, and despite that, you will become a diabetic little slower than otherwise if you not followed your lifestyle. And at that time, you need to be put on medication. There is no way you can control these lifestyle, chronic diseases with only lifestyle changes. Be it BP also, hypertension also. Restrict your salt, it will improve, but again, it will progress with time. And with increase, even if you're restricting your salt intake, eating regular exercise and eating regular fruits, still your sugar, your BP starts going up with the age. That is the natural aging process which occurs in every one of us, including animals. So we need to have these strategies. What is the right time to start medication, and what is the minimum medicine required in this person to keep this diabetes and hypertension in control. And simultaneously, we don't just restrict in Mohan's to treating diabetes. We look at the patients holistically. If you have diabetes, we manage that. We have hypertension, hypothyroidism, we manage that. We have cholesterol, very, very underestimated risk factor. Most people, have heart diseases. Heart disease is caused by blockage of this blood vessels due to cholesterol only, not because of sugar. There are no sugar blocks, only cholesterol blocks. These cholesterol blocks, identifying if your LDL is more than 100, please have a look at your reports. If you are a diabetic or pre-diabetic, please have a look at your old reports. If your LDL, even some labs, they mark it as normal in India. LDL, if it is more than 100, you need to be put on a statin, because sugars will respond to calorie restriction or carbohydrate restriction, and your BP will respond to salt restriction. Cholesterol doesn't. The LDL cholesterol doesn't have much respect. With your dietary changes will not have much of an impact. Unless you are very obese and lose weight, it will not change much. So you need to be put on a statin or other medication in order to reduce it, so that these cholesterol doesn't go and block your blood vessels all over the body. So that is the main importance of treating the LDL cholesterol. So no symptoms for pre-diabetes, Mr. Shankar Babu. Hope we have answered your question. Ms. Sarita Tripathi, very informative. Thank you very much for your feedback. So Mr. R.K. Naidu, what is the best diet plan? I already answered this question previous. So in order to balance a diet, 25% carbohydrates, 25% protein, and 50% vegetables is the best diet plan. And there is no easier way out to manage these diseases just by changing your diet. You cannot manage this diabetes forever. If you're obese in the early stages of diabetes, little uncontrolled, yes, weight loss will definitely improve. And we reduce your medicine to reward you for that weight loss. We are not like you have to take this medicine. So you definitely need to discuss all these things with your healthcare provider and make meaningful choices so as to go a long way, establish a long-term relationship with your healthcare provider in order to manage these long-term diseases better. So can we take mangoes? Yes, Mr. Shankar Babu, I told no, mangoes can be taken, but in limited quantity, provided your sugars are under control. If you enjoy mango, there's nothing, doctor should do to stop it. So in fact, I also love mangoes. I eat them. I'm not a diabetic. So, if you become a diabetic, yes, still, if you're fond of it, you can do that, but keep an eye on your sugars. If your sugars are not controlled, you need to do your best with respect to diet management. Despite that, suppose you're taking medication and with the help of that your sugars are under control, nothing which prohibits you from taking a mango or any other fruit that you like. But should not become a daily affair, and you need to limit it to a small quantity and compensate it by reducing other carbs on the day. Ms. Ramani Satya, doctor, I am a diabetic patient. Can I take watermelon? Absolutely. Watermelon is a good fruit. It can take it in any season, provided it's not very sweet. Even in watermelon, the center core is very sweet. The periphery is less sweet. It contains less glucose. And you can eat the whole fruit, any diabetic, provided the sugars are under decent control. Watermelon is not known to raise your sugars. It's one of the good fruits actually for diabetics to have. So several other, grapefruits, or Mozambique, watermelon, papaya, all these are good fruits. Guava is one of the low GI fruits, low glycemic index fruits, one of the best fruits, I would say, so for diabetics. So all these fruits, any seasonal fruits you can have, provided they're not very sweet. If it is very sweet, you can have a small quantity of it as opposed to a large quantity. Again, Ms. Malati Ravindran, what is the main cause for diabetes apart from genetic? Yes, main cause of diabetes. See, genetics have always been there. So humans, 2000 years back, we were hunting for food, and we don't have all the facilities that we have. We never used to have, 10,000 years back. We never used to have shelter on our heads. So we have evolved very, very slowly over billions of years to this current state. And these diseases, genetics have always been there. But what made this diabetes come faster in the last, 200 or 300 years is the lifestyle. The eating habits have changed. Ready-made food, fast food is available, coming to your house, delivering in the last 5 years. If you see, they are coming and delivering to your ship. When I was in college, 20 years back, let us say, my mom used to prepare a grocery list. We used to go once in every month and pack all those things and come back home. That's the only time we use it. In between, you need anything small kirana shop, we used to go and purchase it and come. We used to go and walk at that time. You know, that was the kind of, when you want to go to school, I used to go to school by walking. When I joined secondary school later, I had to go by, me and my brother used to go on a single cycle. So that was the kind of exercise and lifestyle it was. Now, how many of your children go to school by cycling or walking? If it is like 3 or 4 kilometers. So these are the changes which have occurred in the last 100 years, more so in the last 10 years or so, with the advent of smartphones, GPS technology, these aggregator apps for cabs to food, everything is coming to your doorstep. You don't have to step out of your house. Increase the comfort, but again, our body cannot take it, which has evolved very slowly over millions of years. This is very fast for our own genes to evolve, to adapt to this. So that's the reason we are saying diabetes is coming much faster now. So main cause of diabetes still remains genetic. Lifestyle plays a small role in making it appear much faster. If you follow a good healthy lifestyle, diabetes, if it's written in your genes, it will come definitely, but it will come little later. So that is the main. See, main thing when a diabetes comes is very important. Somebody gets diabetes in the early age. I have 2-year-old kids with type 1 diabetes. They are at more risk of developing these complications because the duration of exposure to high sugars to the organs is very high. And the chances, even if you put a good tight control, you cannot expect a person to live 100 years. Many of our type 1 diabetics have lived up to 70, 75 years also. So we had, in last July in Chennai, we had a session. The highest was 78 years, type 1 diabetic. At that time, in India, very few patients, I think Dr. Mohan's father, Professor Vishwanathan, was the only doctor who was treating diabetes at that time. So when people don't know what is diabetes, itself, diabetes was there in India. Only we didn't know it. That's all. Just like right now we have H3N2. We have it everywhere. Everybody is getting fever, runny nose, and going away. We don't know what is the reason because we're not testing. We don't have an answer to it. That's all. So the second part of the question, if a parent is having diabetes, how can we prevent that from the baby? If it is type 2 diabetes, you are definitely passing down your genes. There is nothing we can do about it. And not necessarily that all the children will develop diabetes. It is the combination of these genes, what we call Mendelian laws of inheritance, which determine the chances of the baby developing diabetes. Definitely, we as parents need to educate our children about right eating from the beginning. And of course, inculcate the habit of exercise every day. I take my daughter to walking. My 7-year-old elder daughter to walking every day, jogging in the morning. Teach her all the physical activities rather than spending time at your screen. And I come to work with cycle. So you have to lead by example to your children. That's what we are going to give. We have given definitely most, if you look for it, majority of us have somebody with diabetes in our families. We cannot do anything about our genes. This is what we are, and what we can do is our lifestyle changes and then compensate for the weak genes that we have as Indians in general. I'm taking, some people don't have diabetes, they're lucky in the family. So Susan Margaret, Doctor, pre-diabetes can resolve only with diet and exercise or medication also next. Again, this decision needs to be taken individually. If you're somebody overweight, yes, definitely losing weight, keeping your BMI even 25, even 5 kgs loss, 5% of your body loss also leads to resolution of this pre-diabetes to normal range. But if you're again lean person and having pre-diabetes, definitely you need to think about, you need to discuss in doctor report your current HbA1c value and how fast it is progressing. That also makes a role. Not everybody progresses at the same fast. There are some type 2 diabetics, who take only one pill a day, and throughout their life, even if they live up to 80s, their diabetes will be controlled. That is a subtype of type 2 diabetes called as age-related mild diabetes, ARMD. Now only world is waking up to see, there are even clusters within these type 2 diabetes, as opposed to somebody who is like, within 2-3 years, their pancreatic reserve will be gone. It progresses much faster, and they will require multiple tablets. After 5 or 6 years down the line, even maximum dose of tablets also won't work for them. At that time, we need to give insulin from outside. That's the only way. There is no other way we can manage. There are no other tablets or anything. Insulin is the ultimate weapon of choice, and don't have any negativity about it. It's been there for 100 years, without which many children would have died. Type 1 diabetes and type 2, even adults lifespan would have come down without insulin. That's a wonderful drug. Cost is a little, it has come down actually compared to before. It has come down, and it will come down even further. Going about the reports happening in USA, definitely that's going to come down. And if you are somebody who needs insulin, definitely do not say no. If your doctor recommends insulin, as a general, I'm saying any doctor, if you go and they know your condition better. And we have read about this entire lives. I have spent 15 years of practice into diabetes, so I know definitely better than a layman. So do not use your knowledge, and your doctor says insulin, don't neglect it and say that you can take a tablet and get rid of it. No, not like that. So please accept. And same thing holds good. If the doctor says you have hypertension, there must be a reason behind that. Question the logic, discuss it, get educated from it, or go to authentic websites like American Diabetic Association, NHS, our own ICMR website. A very friendly manner they have written what is this disease, what you need to do, what is the cutoff for BP, what is the cutoff for saying HbA1c, cutoff to say that you have diabetes and pre-diabetes. All is written in a very friendly format in our Indian websites as well. Education is the real weapon here. So if you can spend that 10 minutes of your time instead of seeing other YouTube videos or fun videos or TikTok videos, better for your own health. If you have a health condition, you are the one who will benefit if you get educated from it. Yeah. So can resolve only with diet and exercise? Yes, diabetes can resolve. Yes, it is reversible, but we cannot say that as a reversal as the marketing people are telling these days. Spend this much money, join this course, and you get rid of your diabetes forever. That is the impression you're getting. Don't fall prey. These pre-diabetes or diabetes, yes, it will improve with weight loss. If you achieve weight loss by your own diet at your home, by following the balanced diet concept, you can save a lot of money. And you are prepared. When your diabetes progresses, you will be ready. Yes, I need to consult the doctor and get the right medicine and keep the HbA1c under control. Yeah. So Mr. Sridhar Sri, blank message. I don't know, he has some trouble putting the message here. Miss Mosmi Rai Mukherjee, I'm diabetic 10 to 12 years. I'm suffering from ulcerative colitis. What to do? I'm so sorry to know that, Miss Mosmi Rai Mukherjee. By the name, I guess you are from Bengal. So Bangalore is the hot area where Bengal people come down here for all kinds of health issues. They usually come down to Bangalore for their healthcare needs. That way, Bangalore is privileged to have you. Definitely, you're diabetic 10 to 12 years. Whatever happened, we cannot bring back. If your diabetes is not under control, organ damage would have occurred, even though we cannot measure it by rules that we have. Only a damage is happened to certain level, then only we can measure it. Prior to that, we cannot bring it back. So important, achieve your HbA1c below 7. And ulcerative colitis, it's an autoimmune condition which damages your intestine, and definitely need to follow up with a gastroenterologist, because I'm not an expert in that. I have limited knowledge about it during my internal medicine days when I did my post-graduation, and subsequently I specialized into diabetes care. So I am following that, and I am not well up to date with ulcerative colitis. So that's my honest answer. And you need to contact somebody who has knowledge in that area and manage it. Where ulcerative colitis is a chronic condition like our diabetes, and it needs to be managed with the right amount of medicine at the right time, in the right doses, with proper monitoring. People live longer even with ulcerative colitis. Previously we don't know what was the cause, and we don't have medicines now. Mesalamine has come, and alpha salicylic acid. All these medicines are there for ulcerative colitis as well, which will increase the lifespan of the patient. So you don't have to worry about those disorders. Like there are other dangerous diseases, cancers and other, my patients, some of them gets diagnosed with cancers also. We see that. And dangerous infections, they take away the patient's life within a week or 10 days. So COVID-19, influenza, all these things. So much better than having them. So definitely don't worry about your illness, and definitely there is good treatment options in 2023 as opposed to before. Only thing, you need to get connected to the right person, right gastroenterologist, to treat your ulcerative colitis and have a good control of your diabetes in order to live a full long life. I think we have come to the end of all the comments. So please feel free to comment. We have 5 more minutes left of this session. If you have any more questions, please feel free to post it here. Even if English is not your language, you can put it in your native. I can use Google Translate to translate that to English and then answer you. Let's wait for 5 more minutes. I hope this session has helped some of you. Please spread on this message to others, and please subscribe to Dr. Mohan's channel. This is the channel where several of our doctors will come in and share their knowledge purely from a philanthropy point, not to make any business or anything out of you. So definitely, if you need our help, we are there on the clock. We have 51 branches all over the country, predominantly south, and we have in Bengal also 4 or 5 branches, Kolkata. City, we have 3 branches, I believe. Not much presence in North India. We are planning to, that's still in the works, or even to Mumbai, to the west part of the country. But we are available through teleconsultations if you need our service. So that's not the best way, but again, something better than nothing. We can explore other ways as to how it can help you through that as well. I think that's the end of the questions. Let's end this session. Oh, one more question from LinkedIn. Okay, good. I didn't know that this feed is shared in LinkedIn as well. Hi, doctor. Could you please tell us about the dietary management? Oh, okay. Again, this is the 3rd or 4th time I'm going to talk about this. See, dietary management has a limited role, what we call medical nutritional therapy. Listen again, if you're not joined earlier. So yeah, this diet alone cannot control diabetes forever. It is a progressive disease. Diabetes is a progressive disease. With age, it will worsen. Initial stages of diabetes, by restricting the carbohydrates and by achieving some weight loss of your overweight, you can avoid the need for our medication, what we prescribe. But only half of the patients achieve that. Half the patients don't achieve that. Difficult to control weight. When you control your hunger, your cravings will increase for the food, and you feel miserable. Your happiness factor will come down. All these factors are there. That's the reason why half of them can achieve the weight loss. If you achieve weight loss, good. Nothing like it. Continue to maintain that weight loss forever. Whatever means you use it to achieve that weight loss, you need to sustain in order to get those benefits. But again, general rule of the thumb, reduce the carbohydrates to 25% of your meal, every meal. 25% should come from protein, 50% should come from vegetable source, all kinds of vegetables except starchy ones. So that is a good dietary management of diabetes. And don't be under the impression that diabetes can be controlled by only diet. No, not possible at all. And it is a progressive disease as age advances, just like we develop skin wrinkling and white hair with time. After 10 years down the line, I might have white hair. So my skin will become older. When I was younger, 15 years younger, my skin was much leaner. I was much leaner. Now I put on weight. It's a normal tendency to put on weight and age with time. We cannot postpone that just by the diet. Similarly, we cannot control diabetes forever with diet alone. Hope to have answered your question. I think that's the end of the question. We'll close this session. Please stay tuned to this channel for many more sessions like this from other doctors, and I'll also keep coming, share this knowledge sharing sessions on separate topics of interest that arises at time. Thank you. Have a good day. Bye.